Hi everyone, Fertility Empowerment Show, another episode, but another amazing guest today. And I know a lot of you who are struggling with fertility issues want to know what other medical doctors, especially gynecologists, think about it. This is not the first gynecologist I talk to. All of you know I talk to so many of them, but this woman is very special. She has lots of skills. She's been there through her fertility issues, and she conquer a lot of fertility. And I'm really amazed. Just reading her bio, I was like, wow, I have to talk to her. And she's not only doing the medical, she's also functional medicine. She has been through other integrative holistic medicine practicing, and here we are. We have Tara Scott, Dr. Tara Scott. Welcome to my show.
Thank you so much for having me, and thank you so much for what you do to spread awareness for patients struggling. I wish there was something like this that I could have listened to when I had my infertility problems, but there wasn't anything like this.
Yes, because Tara, there are a lot of resourceable people like you, and a lot of them hiding behind the scene. Not everybody can hear their voice, and that's what I'm doing, because I know not everybody know about holistic medicine, and you are the great example because you are on both side of the coin. You are fertility expert in medical, and then finally you are integrative medicine. Okay, tell me about your story. I know you had lots of challenges. I really wish my audience also listen to these challenges.
I started out very traditionally trained, and I, as a matter of fact, at the age of 23, finished medical school. And I went on to do OBGYN residency, which is very rigorous at the time. You know, this was way before there was any kind of limit on hours. And I loved working with women in all stages of their life. When I finished my training, it became time to try to have a pregnancy myself, right? And, you know, I knew I had a problem with painful periods. I suspected that I had endometriosis, but, you know, month after month after month, not conceiving. Then, you know, for the first pregnancy, I did have to take Clomid. But thankfully, you know, with the first round of Clomid, I got pregnant. After that, when it came time to try for the second time.
Sorry, I interrupt you. What age were you in? Just tell me all of them. Yes, please.
So I was 28 years old when I started trying to get pregnant. So I was young, you know, I was trying to get that first pregnancy in before 30, right? So I had very irregular periods, and it wasn't until I actually took the Clomid the first time that I got pregnant with my first daughter, and I had her just before I turned 30. So then when it came time the second time, I would have been 31, you know, 32. I had 6 failed cycles of Clomid. Then they said, okay, before we move on, we have to do a surgery, a laparoscopy. I had the surgery. That's when they confirmed that I did have endometriosis. They tried to clean that out a little bit. Then I had 5 failed cycles of injections. Then I had a miscarriage. And then I had another round, another failed cycle, and a hyperstimulation. And I said, you know, I feel terrible. This is awful. So then I had the in vitro because nothing had worked. I had all those failed cycles, had the miscarriage. And, you know, it's interesting. The month that I had my in vitro scheduled, my husband's grandmother came back down with ovarian cancer. My father was being treated for cancer. And I said, oh, this is the worst possible timing for me to have a retrieval. But, you know, miraculously, I did conceive 2 twins. Okay. And I had a terrible pregnancy. I was at bed rest for 14 weeks and I had an emergency surgery at 20 weeks to sew my cervix shut because I was starting
Wow,
to dilate.
gosh.
Yeah. So that was one of the hardest things that I had to go through is the infertility, the treatments, the pregnancy. And then with my twins, I had the first one vaginally, the second was an emergency C-section. And when
Oh
I
my God.
had the C-section, my epidural was only enough for a vaginal delivery, not for a C-section. So I felt everything except for the skin incision. Yes, so it was really difficult.
But it was very promising because I have, as I said, I have a lot of questions from you. I have clients with endometriosis and irregular period, and they are not um, really hopeful. And I know they have to take medicine as well because endometriosis, you have to take medicine. But there are also a lot of what I do, like give them diet, a lot of other diagnoses because it's not only in endometriosis. They may have some underlying issues as well, right? Uh,
That's absolutely true. And the
yeah,
treatment right now for endometriosis is aimed at treating the symptoms, not the cause. And
I
that's exactly what you're talking about is there's an underlying cause. And if we just focused on that, that's what I did. And I cured my endometriosis.
yes. So I let's just dig into it. First of all, how much? I mean, what was the gap between every clomid um, taking clomid? I know. I mean, let me just clear it. How many gaps you had for any planning? Did you go one after another, or you had some gap?
I wanted to do that, but every time I took Clomid, I had a cyst on my ovary. So I'd take a cycle of Clomid, then I had to do an off cycle. You know, they make you take birth control pills
Yeah,
to suppress the cyst. I wish I could have gone cycle back to back, but I usually had to do every other cycle.
but still, it's too much. Every other cycle is too much.
Yes. Yes.
And that's what I do. Like for my clients, I always said, don't rush. Even if you are over 40, take your time. You need at least 120 days to remove your toxins and mature your eggs. So that was the problem because everybody has IVF. They say, okay, let's do it one more time. Let's do it. So they don't wait too long. After like 1 2 cycles, they go to another one. You know, their body is still try to come up with these extra hormones. Is not happy. Is very exhausted, and then again another failed cycle.
Well, you know, I remember what it was like to be desperate to get pregnant, right? And it's when you're a fertility patient, you just are consumed with counting days and if your period's coming. And, you know, my period was so irregular. If it, I could just say today's day 28, it's going to come or not, then it would be easier. But every month I thought I was pregnant. So it was devastating whenever I got that negative test. So I remember being on the other side. Yes, what you're saying makes sense. You need to give your body a break. And I didn't know what I know now about integrative and functional medicine and diet and the effect of stress hormones on ovulation. You're exactly right. But I didn't know that. So I was also pushing myself and caused all kinds of hormone imbalances in my body from taking the drugs, from all the stress.
Yes. Wow. So what is the difference now? You, let's say if you get back to past, what do you do differently?
Okay, so for me, I found the reason that I had a problem. Well, a couple of things that were the problem. One, I had Hashimoto's thyroiditis, so an autoimmune thyroid condition that was causing a problem. Two, I had too much stress. Three, I had estrogen dominance because I had a problem with my estrogen detoxification because of genetic problems. So I had MTHFR and another enzyme, COMT, that were genetically altered. So my body did not clear estrogen properly. So that was the reason that I got endometriosis causing inflammation, causing excess estrogen, causing a problem with ovulation.
Okay, I have another question. Did you have a sleep shortage as well?
Yes,
Yeah,
absolutely. Are you
that was
kidding?
because yeah,
Yes.
because that's what I always get from my clients. They have a sleep shortage, and then I said, "Wow, that was the problem."
You're
That was,
exactly right. You're
yeah,
exactly
yes.
right.
So, can you clarify why a sleep shortage, and what does it do to fertility, and how we can solve it?
So when you don't get enough sleep, either because you're not allowing yourself enough hours to sleep, or because you can't, you're unable to, or you don't have the time, what happens is your cortisol is affected. When your cortisol goes up, it suppresses the brain, the pituitary gland, from releasing FSH, LH, TSH, and it suppresses ovulation. It also slows down your detoxification of estrogen. So it's promoting estrogen dominance, it's preventing ovulation, you're not making progesterone, and it's a vicious cycle.
You clearly explain it the way I like it. Like exactly all the hormones are really, really related to each other. That was the thing I didn't know. Like everybody goes there, do the blood test. They say, okay, just go with LH, FSH, they just go with the fertility hormones when you go to medical doctors. Unfortunately, maybe thyroid as well, but the problem with the thyroid, if you are not functional medicine, is that they said you are in a normal range. But no, we know this is not normal.
That's correct.
Sometimes even with other blood other blood factors, I always say you are in normal range, but you are very close to the end. So if you have more sugar, you will end up like passing it, you know.
Yes, and the thing is, as an OBGYN, I wasn't taught how to check hormones.
Oh my goodness. That's interesting.
Yes, they don't teach us how to manage it. They teach you a little bit about infertility management, checking hormones for the guise of infertility, but you said it exactly. You're very close to the normal range. Those normal ranges are very large, and they're made to detect disease and tumors, not imbalances. So although it says, thank God you don't have a tumor or you don't have a disease, it's not made to see if you're in balance.
Yeah, I talked to one of these medical doctors. She's amazing. And she's a hormone doctor. She's working on hormones. She also said the same thing. Nobody could find her problem. Whenever she checked the hormones, they say your thyroid is okay. But then she researched and she just find out, oh my goodness, she has to change a lot of lifestyle, everything. And then as soon as she worked on thyroid problem, she got pregnant. She has 4 boys right now.
Wow.
And I see uh, the problem right now is this. I talk again to some OB, and they said we are not infertility specialists, so we can't actually suggest anything about this. We know something, but we don't. We have to go to fertility
Hmm.
specialists.
Hmm.
So maybe that's because of the hormones, because there are some medical labs that they don't go through, and the fertility specialists go. And that's why I'm asking you, why there are some gaps there. What can we do? Like, what do you recommend to somebody who's struggling with fertility issues for years?
So there is a big gap, you're right, because when you're trained as an OBGYN, we are trained how to cut a baby out in a minute for an emergency C-section. We can do surgery, we can deliver babies, but we're not taught very much about office, how to manage abnormal periods, how to manipulate hormones. And if you do infertility specialist, it's 3 more years. You're taught about how to treat endometriosis surgically. You're taught about the fertility drugs, how to dose them, how to monitor them. But you're not taught to do anything with the patient outside of fertility drugs and how to manage their diseases. So, for example, after they're done with their kids, how do you treat their hormone imbalance? So we're not taught that. We have so much else that we have to learn and master in OBGYN. So, what I would recommend for patients to do, and now with social media, podcasts, internet, it's very easy to vet a provider and find out who has extra hormone training. And so I know on our website, we have a free download, What You Must Know About Women's Hormones. It talks about here are the different ways to look for a provider. Make sure they have this credentialing or this credentialing. Here are the different types of testing. Here are the questions to ask. Because if somebody isn't, there may be an OBGYN who has a lot of knowledge. I'm not saying they don't, but I'm telling you, as a traditionally trained OBGYN, I did not get my hormone knowledge from that training.
I hear you, because with my medical doctor, unfortunately, even the fertility specialist, they gave me wrong information. And I always, like they said, first of all, the first thing they focus is your age. And this one really bothers me because I see a lot of women, even in 47 age, right? I have clients, she got pregnant, 47-year-old.
Wow.
And that was because of her belief system. She didn't feel that she's old.
Oh,
And
well, mindset is a whole nother topic,
yeah,
right? That's very,
she was healthy. And the problem is she got married very young. She was in 20s, and she terminated her pregnancy in 20s. And that's she was in trouble for years. So she had lots of miscarriages for 20 years. And then suddenly she asked me for help. I said, okay, what do you do? She said, I'm working. I don't want to like talk clearly about what she's doing, but she had lots of workload. And that was the problem. That was the first thing I always ask my clients, what do you do? Because they're wasting energy, and they don't allow themselves to produce something inside. And they make lots of worries and anxiety in their mind.
that's true.
So yeah, so I said, you work a lot since you've been 20s. Don't you think that you have to do something right now if you want to have baby and your priority is baby? So don't do the job that you don't like and you have lots of workload. And finally she got off her job, she quit. And then something amazing happened. Her sister got pregnant, and she was younger than her, and she had to go there, another city, to help her. And she realized how taking care of the baby is. So it looks like she trained herself to be a mother. She was really close to that reality. And finally she got pregnant after 2 years. 2 years being with her sister.
Wow.
Yeah. So it's beautiful what you say, but I'm gonna dig into other skills you have. How can you talk about it? I know you have a story about your brother, and how get you into functional medicine, because as I see, functional medicine is after having babies, right?
Yes, for me, yes. Yes.
Yes.
So I had all the problems with infertility. I first started learning about hormones about 18 years ago. I started practicing, with bioidentical hormones and treating women with hormones. And the more I learned, I realized the less I knew, right? So then I kept learning and went and did a fellowship in functional medicine. But 13 years ago, my brother suddenly passed away of a heart attack. He was 38 years old. And, it was very sudden. I talked to him, and then the next day he was hiking and he had a heart attack. But when I looked at the autopsy and kind of unpacked it, he had every risk factor. He was overweight. He was a diabetic. He was a smoker. He was on a statin. He was stressed. He was a lawyer. So he had every risk factor, and it was a very preventable death. So that really profoundly changed the way that I looked at medicine. And I thought, there's got to be a better way to do this. Why aren't we just looking back here and preventing this? So that's when I began to study more about functional medicine, wellness, prevention, cardiovascular, gut, everything, integrative medicine, and really focused on, trying to work even within the hormone imbalance on focusing on insulin, preventing diabetes, reversing diabetes, healthy weight, all of that with women and with men in our practice. But it just made me more passionate about wanting to prevent other people from experiencing the same issues.
That was beautiful. So, if you get back there, your past when you were trying to have your baby with Clomid, do you recommend Clomid again to your patient right away?
Well, for me, I would have cleaned up my diet. I know the second pregnancy I was underweight. Didn't weigh enough because I was so stressed out. I lost all this weight. So my cortisol was probably a huge problem. I would have tried everything holistically to balance my hormones. Now, having said that, I was desperate, like I said, to have kids because I always wanted to be a mother. I don't have a close relationship with my parents, so I wanted to prove I could do better, right? That was just my whole goal. So it's hard to say if I would do it again. I would like to think, knowing now, I would definitely try everything else and fix everything else. But if that still didn't work for me, I'm glad I have the kids I do.
Yes. But as you said, it's better you go with underlying issues first.
Yes.
And it's not really difficult, to be honest. With a simple diet and with simple removing toxins and diet, you can change a lot.
Absolutely. And you know what else? Not only conceive, but better health in the long run.
Yeah, for yourself, right? Like, because when I started acupuncture, I switched acupuncture 3 times. The reason was that my heart was not with the two of them. Like, you have to realize the doctor you are working with or the specialist. If you are not with them or you don't click, then it's not your destiny. That's my like that's my belief.
Mm-hmm.
And then this third one, I knew from the beginning because he actually dig into my diet. He actually talk about different issues I had, and that was the first time I was I was aware of what I'm going through, right? Because
Mm.
I talk to my clients. They say we went to acupuncture. They just did needles, and
Mm.
that's not
Well,
enough.
there's a difference between somebody who's trained to do the whole chi treatment, right? The holistic acupuncture, or a specific complaint.
Exactly.
Like if it's a doctor or a chiropractor, nothing wrong with them, but they get certain hours and they can do acupuncture, but they're not the licensed acupuncturists in Chinese medicine that they.
Exactly. They are not traditional Chinese medicine practitioner. And
Yes.
because that one takes another 2 years, I
Yes.
guess.
Yeah.
Yes. So that's why I said, he told me you have a cold body and you have a
Mhm.
liver issue, And
Mm.
if you go to medical doctors, they never tell you that you have these problems.
Did he look in your tongue and take your
Yeah,
pulse?
yeah,
Yeah.
yeah, exactly. Yeah. So, give me some example of your practice after having your functional medicine with your patient. I know right now your success rate probably is much higher than before.
Yeah, so Revitalize, I opened in 2013, so we're going on 8 years. And we treat women of all ages. I love to work with younger women because you can prevent problems, right? Prevent endometriosis, acne, breast cancer, problems, bleeding, and everything. But we treat all age. Now, I don't prescribe fertility medication. We work holistically to try to balance hormones, and people have gotten pregnant, but we don't write the fertility medications at our practice. We can refer if that's what you want. So we work on the gut. We treat a lot of food allergies. We treat stress. We talk about diet. I have a health coach who works with me. I have a naturopathic doctor who works with me, and also just another MD who started working with me is still kind of finishing. She finished her functional medicine certification, and she's starting out just working a couple days a month to get more experience as well.
Tell me about GI and food sensitivity uh, uh, lab, because these are two I always recommend my clients.
I agree. That's another problem that I had. Which came first, the hormones or the gut? I had gut stomach issues since medical school. I ended up having gluten intolerance and lactose, and casein, really all dairy problems and sensitivities. I ended up having, bacterial overgrowth in the gut. So it's all there. I don't know what came first for me. So we end up seeing quite a bit of it. And, there's some debate as to how accurate are those allergy tests. There's the ones that are direct to consumer. There's the ones that look at your microbiome and determine food sensitivity. So, everybody has a different opinion. I find the blood testing to be somewhat helpful, but we also do the stool testing to make sure that we look at your gut, your microbiome, and we also recommend a simple elimination diet and
Exactly.
and detoxification.
Yeah.
You said.
Exactly. That's the first thing I do with the detox. I know there are lots of ways to detox, but I have my own method. Because that's the one worked for me. So because it did a good job for my body, so I always recommend. Uh, I have lots of. Still, I feel that I have a lot of questions from you. So, what about the family history? Like, I know I'm a PTSD coach as well. So, I talk about their traumas in life because I know that really affect fertility. Do you agree?
Yes, I 100% agree. And I will tell you again, as a traditionally trained doctor, I didn't understand the connection of trauma to everybody until I had a major physical trauma. And then I look back and I had all these other childhood traumas that probably, you're right, had something to do with my hormone imbalance.
Yes, thank you. Because as you see, when you have unprocessed PTSD or not, because PTSD is a very difficult terms for many people. People don't digest it. They say, "Oh, we don't have PTSD," but whatever trauma you had in your life, everybody has trauma somehow, and this trauma really affect your hormones, your body, and even if you feel healthy, you feel fit. Again, there are lots of underlying issues. That's what I found.
I agree. And I'm not a trauma expert. I'm still learning a lot about it. I'm reading the book, The Body Keeps the Score, and I'm still trying to familiarize myself with it so I know when to refer out, when to think of that for my patients to recommend that they get that, because it wasn't on my radar.
Yeah, I have another question. Do you believe that blood type affect the body diet, and do you do you go with it?
That's a really interesting question. And I will tell you, so my blood type is A positive. right? And so I think by the blood type diet, I'm supposed to be vegetarian,
Yes.
which makes sense because I'm half Indian, half Puerto Rican. And so they say you're supposed to eat like your ancestors, and my ancestors would be vegetarian, right? So interestingly, also, so your question is a couple things. One, do I think you should eat based on your blood type? I think there is some truth to the eating like your ancestors, and that would tie into your blood type. And the second question was, does it affect your health? And I will tell you that in October, I got COVID. And I was very sick. For me, I'm the healthiest person I know. And I ended up being hospitalized overnight because my oxygen levels were so low. And I was taking all the supplements before. On day 2 of COVID, I ran 10 miles. So I was very, very healthy. I was taking all the supplements during. But I have that blood type that is the one that's been studied. There's one study that was said with COVID that A positive people who had that had worse COVID. So it probably has less to do with the actual blood type than the rest of the genetics, the genomics and the epigenetics that's associated with your genetics.
Yes, yeah, genetic. But these days, I hear a lot of thing about epigenetic,
Yes.
and people say even environment has more into it. Because
Well,
I
yeah.
remember, yes, I remember I never had asthma when I was back in Iran, and then I went to Australia to study. There, my asthma started.
Hmm.
I think there is so much with the weather and the environment you change. Environment may change your health.
Well,
And
what
then,
do they say
yeah,
that so genes load the gun and environment pulls the trigger?
yeah, is it? Yeah, interesting. Interesting. All right, tell me about your program here.
So my online program or what we do with
Yes,
patients?
yes, your
Okay.
online one, the coupon for
Yes.
10% off.
So I have been teaching other doctors how to do this for over 10 years, and I've taught my course in 5 continents. So that's my claim to fame, is that I've traveled
That's great. That's virtual.
yeah,
Oh, beautiful.
Australia, Singapore, Malaysia, Philippines, Barcelona, UK, and Canada and US, and so and Brazil. And so I really love teaching, love explaining things. And so last year, when everything was shut down for COVID, we couldn't go on our spring break. So I had 1 week, no patients scheduled. And I'm the type that's always busy. What am I going to do? And I just finished a conference saying you should do an online course. And lots of people would reach out to me on social media. And because I'm only licensed in 3 states, I can't work with patients that aren't in the states I have a license in, right? So, and most of the time, doctors can only work in 1 state. So I was trying to think of a way to help people. How could I
Mhm.
help reach more people? So I already had a lot of content, and myself and my IT person, we created an online course, Revitalize Your Hormones. And so there's a foundation course that talks about what are hormones, what do they do, how to detect them, how to test them, what are the causes, what are the symptoms. Each of the videos is just about 10 minutes long. So you could, watch while you're cooking dinner, very quick. The whole thing's about 2.5 hours. And then after that, you have the option of, if you want to learn more about PCOS or anxiety or breast cancer, you can pick the topic you're most interested in and just do that. And we've changed it so now it does stand alone. You don't have to do the foundational course first, but if somebody wants to learn about menopause and osteoporosis, they're not going to want to know about infertility, right? So that's why
Yes, for sure.
yeah, that's why we separated all those out. So it's an educational thing, but you do get a step-by-step plan of things that you can do. We talk about estrogen detox. We talk about, environmental toxins. We talk about how it affects us. We talk about infections, yeast, those kind of things. So if someone, doesn't have a provider, they can watch the course and see, what can I do to help myself? Like you said,
Exactly.
what you do, right? Right.
Yes.
So here's the information, from an MD, how we go through everything and tell people. So we made that course almost a year ago, not quite a year ago. We launched it in April or May. So it's not been quite a year. So that's on our academy.
Hmm. Because Before I started fertility coaching, I was very blind, to be honest. I just I even couldn't read my labs. Right now I go through it because it's so clear. You can read the normal, can do a little bit research. It's great to have knowledge on your body.
Yes.
So this course can be,
And give you that.
yeah, can be effective for many people. It's
Yeah.
not only medical doctors or anybody who was in health practitioner, right?
It's made for patients. I've had a lot of doctors go through
Beautiful.
and say, I've had doctors go through and say, wow, I really learned something, but it's
Yes,
made for patients.
patience.
Yeah.
That's even better because that's what we lack.
Yes.
Everybody just go, they don't know what's happening to their body. They are just waiting for their instruction to follow, and they really don't know. People don't know why they take Colomit. Believe,
Right.
believe me, they don't know why they take different medications. They just know they have to take it because of the symptom that they have.
Right. Because they're not trained to ask why and to
Exactly.
look for the reason and the cause.
Yes. All right. Thank you so much. I don't get tired to talk with you for hours because still I have a lot of questions. We may have you one more time
Sure.
later, yes, because you are very resourceful, very knowledgeable,
Thank
and the
you.
good point is you have connection, and you actually broke the gap between the medical science and holistic medicine, and that's the beautiful part of it. Thank you for being here, and hopefully we can have you again later.
Thank you so much for what you do. And like I said, I wish there would have been a fertility coach for me when I went through it. So thank you for all what you do for patients.
Yes, thank you so much. Bye.
Bye.
Please subscribe to Panta Calhor Transition channel and order my book Naturally Conceived through Amazon. Thank you